Hello, my name's Jackie James, and today we're going to look at giving your baby a reflexology treatment. So treating babies is really safe, it's non-invasive, and you can treat your baby as long as they have no serious medical problems from the moment they are born. If your baby does have any serious medical problems, it's really important that you consult a qualified reflexologist and not use this video. How long should you treat? Well, as long as the baby's happy to be treated, and as the baby gets used to having treatments, they will be happy to stay still for longer. But a newborn baby, you're talking about 10 minutes, a 6-month-old baby, 15 minutes, and a 1-year-old, 20 minutes. However, you can treat your baby several times each day. So the more you treat them, the more they'll get used to the lovely relaxing treatment, and the longer you'll be able to stay treating them. When to treat? Well, having a routine where you treat your baby at regular times of the day can help. And if your baby doesn't settle well, treating before bedtime can be very beneficial. So how to position you and your baby? Well, it depends how old your baby is. It's important that you're both comfortable. But what you can do is put a pillow on your lap, and then you put your baby on the pillow so that its feet are towards you. So this can work with a larger baby or an older baby if you sit on a sofa so that your legs are out straight. So you can actually treat quite large toddlers that way. So the reflexology technique we're going to use is caterpillar, and you're either using your thumb or your index finger, and you're going to press on the baby's feet, move along a tiny amount, and then press again. So if I do that on my hand, I press, release, press, release. This should cause absolutely no pain to the baby, and the gentle soothing motion should actually start to relax them fairly quickly. So you can either use your index finger or you can use your thumb. I'm moving along a tiny amount each time, and I'm not sort of dragging any skin with me. I'm lifting enough just so that I'm not dragging any skin. It's also important that you support your baby's feet when you're treating them. So if that's your baby's foot and you are just flexing the foot, that's not reflexology, that's just flexing the foot. So you've actually got to support your baby's foot so that the foot isn't moving and you are pressing. But again, it's a very light pressure. It's not going to hurt the baby at all, and hopefully they'll find it very soothing. So that's my little baby's foot on the screen. So you should aim to cover the whole of the baby's foot from different directions, working the soles of the feet. So in this video, we're not going to work on the toes at all. So let's look at our first direction. We're going to go like diagonally over the feet. And if I just get my little foot there, so if I'm going diagonally, I'm moving across. A nice gentle movement all across the foot. And even with a really small baby, you should get at least 8 runs across the foot. If you're working on a bigger toddler, you might get double that, you might get 16 runs. So it's covering the area that's really important. The direction doesn't matter, but we just want to cover it from different directions. So let's look at our second direction, and we're just going to go across the foot. So again, we're going to go across the foot until we've covered the whole of the foot. And a third direction, again, you can choose whichever directions you use, but do 3 different directions, and that will make sure that we've covered the whole of the foot. Do that on both feet. Then if your baby's having trouble pooping, you can work the colon over both feet. So if we look at the colon on my little baby here, the colon starts On the right foot, it goes up, across, over to the left foot, down and up. So we're going to work starting on the right foot. We'll work up to almost the middle of the foot, not quite. Then we're going to turn right. We're going to go onto the left foot. And we're going to do that pattern on the feet. So if you're not exactly sure where you should be working, do it. Some of the runs do slightly higher or lower, but do that 5 or 6 times and as many times in the day as you can. And you can actually just do this section. So once your baby is used to having the reflexology, you can just do this section. So with the previous section, the direction wasn't important. With this section, the direction is very important because we're going from the sort of innermost bit of the colon right to the outermost. So you need to go the direction of the arrows on this. And if you look at the feet, the right foot is actually on my left. So it's your baby's right. And then just finish with a gentle massage of both feet. So that's the end of the presentation. So thank you for watching.